Ensuring there are no foreign bodies left in the body is very important. It can cause serious health issues for the patient, such as inflammation where the foreign body remains, pain and discomfort, and often hospital readmission. There's also the risk for exposure to radiation due to needing to have x-rays to locate that object. If a foreign body is not noticed or causing pain right away, it can lead to infection within the body over time. Sharp objects such as a blade or scalpel can lead to organ or blood vessel puncturing, causing internal bleeding. Surgical sponges can collect pus around the sponge and then cause infection. Objects being left inside the body can also cause abscesses to develop. Most items used in the surgical setting can be detected because there is a radiopaque material intertwined in the sponges and towels, and then the instruments are typically some form of metal that can also be detected by x-ray machine. The most common form of material being retained in the body is the surgical sponge. There are many safety measures in place to help ensure these types of incidents don't occur, such as the use of count sheets, knowing when to count, and standardized tray sets.
As the instruments are assembled, they are assembled in the central sterile processing department by an assembler, and he logs and checks off the instruments that he put in a tray, and then they're handed off or set, for the sterile or the surgical technologist and the circulator to count off, and she logs down the instruments as he counts them off. They're confirmed together by both the surg tech and the circulator. They're in several different wound closure processes, and then if there's any, sometimes they're wavered if it's an emergency case, and then later on they get with the hospital policy and do any kind of post-operative type counts to the policy. And let's see, as far as the sponge counts and instruments all together, that's all kind of added in. And then Frank will tell us about the timing of counts.
Preoperative counts, sponges, sharps, instrument counts are very important. They're important for both patient safety and legal reasons. Counting should be performed according to your healthcare's policies and should be done with the utmost precision. Once items are counted, linen and trash bags should not be removed from the OR until the patient is completed the surgery and is being transported out of the OR. When to count, we do a pre-operative counts. First counts all sponges, sharps, bovie tips, and instruments on the sterile back table before the skin incision is made. Intraoperative counts or cavities within cavity counts are necessary when the closure of the cavity within a cavity occurs. An example of this is during a closure of a uterus during a cesarean section. Cavity count during the closure of the body cavity, an example of closure of perineum, and the count must be completed before the closure is completed. The last and final count completed during the closure of the skin layers. Things to note: trauma does not have a count because it's an emergency surgery, and an x-ray at the end will ensure that nothing is left inside the body.
And just as Frank just told us about the proper number of counts and the timing, I'm going to talk about the proper number and the procedure at the beginning of a case. At the beginning of the case, you should have a preoperative count done, starting with your Ratex. For Ratex, we usually have 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. So we're good on Ratex. Next, we move on to our lap pads. We should have 5. 1, 2, 3, 4, and 5. Moving on, you're going to count your sharps. In here, we have one blade in our sharps box, we have one hypo, and we have two bovie tips. 1 and 2 already on our bovie. From there, we're going to count any extra materials. We have our suture, which should be in our sharps count, and then we have our thread, which could also be lost in the body cavity. After we've done our sponges and our sharps, preoperatively, we're going to move on to an instrument count. Here for an instrument count, I have 1, 2 towel clips. I have 1, 2, 3, 4 mosquitoes. I have 1, 2, 3, 4 hemostats. 1, 2, 3, 4 Kellys. 1, 2, 3, 4 Cokers. 1, 2, 3, 4 Alices. 1, 2 Babcocks. 1, 2 right angles. 1, 2 needle drivers. And then 1, 2, 3 scissors, and 1 Forester sponge stick. For that to conclude our talk about foreign body center tension and demonstrating a proper count.